Hey everyone, in this video we are going to discuss about the dentigerous cyst. It is the most important topic of the oral pathology and it carries a weightage of 15 marks in the university exam as a long note, or it can also come as a short note. The headings under which we are going to cover the dentigerous cyst are its definition, pathogenesis, clinical features, radiographic features, histopathological features, differential diagnosis and the treatment, and also the complications. In this diagram you can see that there is a cyst which is present over the crown of an impacted teeth. Now what is the impacted teeth? Impacted teeth is which is not erupted into the oral cavity and is located in the jawbone. Now the dentigerous cyst is also known as follicular cyst, pericoronal cyst and also called as follicular odontoma. Beginning with the definition, it is an odontogenic cyst that surrounds the crown of an impacted teeth caused by the fluid accumulation between the reduced enamel epithelium and the enamel surface, resulting in a cyst in which the crown is located within the lumen and the roots outside. Now, in the dentigerous cyst, the crown of the impacted teeth is surrounded by the cyst lumen and the roots are present the outside. The fluid accumulation occurs between the reduced enamel epithelium and the enamel surface. The dentigerous cyst is derived from the reduced enamel epithelium. Now, in both the diagrams, we can see that the crown of the impacted teeth is covered by cyst and the lumen of the cyst is filled with the cystic fluid. You can draw these diagrams in your university exam to make your answer more representable. The pathogenesis of the dentigerous cyst is usually unknown, but it is assumed that it occurs due to the obstruction of the venous outflow from the compressed follicle, which results in the transudation of serum into the follicular space, which leads to the formation of the cyst over the crown of the impacted teeth. Now, discussing about the clinical features. The dentigerous cyst is attached at the cemento-enamel junction and it encloses the crown of an unerupted tooth, that is impacted teeth. The most common tooth involved are its mandibular third molar, as you can see in the diagram. Next one is maxillary canine and third molars and the mandibular second premolars. The males have a greater ratio than the females. Now coming to the age, it mostly occurs into second to fourth decade of life. Initially it is present as a bony hard in consistency, that is like tennis ball like consistency, and later on eggshell crackling. Now coming to the radiographic features, it can be of both, that is unilocular and multilocular. First we will talk about the unilocular. It is a well-defined radiolucency with the sclerotic margins. It has its three radiological types. First one is central, then lateral, last one circumferential. In the central, the crown of the impacted teeth is involved, and in the lateral, one side of the tooth is more involved, and in the circumferential, whole of the tooth is covered with the lumen of the cyst. Now coming to the second one, that is our multilocular type. In this, there is a soap bubble like appearance or the honeycomb appearance. Now I will show you a radiograph of the dentigerous cyst so you can better understand. The marked radiolucency is a dentigerous cyst which is involving the right lower mandibular third molar, which is remain unerupted. The symptoms are swelling, pain and tooth displacement. The radiograph presents us as a well-defined unilocular radiolucency. Now coming to the histopathological features. This is a histological diagram of the dentigerous cyst. The first one, there is 2 to 3 cells in thickness and the epithelium is non-stratified squamous epithelium. The fibrous capsule is usually uninflamed. There is mucous cell metaplasia, that the one cell form changes into the another form. Lipid-laden macrophages are also present. Hyaline bodies are present and the homocidrin deposits are seen. Now what are homocidrin deposits? These are the iron storage pigment granules which are formed from the breakdown of the antibodies from the excess of the iron. Now discussing about the differential diagnosis, that what other differential diagnosis of the dentigerous cyst can be present. The first one is periapical cyst involving an overlying primary tooth. It also looks like a dentigerous cyst. Next one, unicystic ameloblastoma. You can see in the picture. Third one, adenomatoid odontogenic tumor. Now coming to the treatment, if it involves a molar teeth like third molar, then we will do removal of the associated tooth along with the enucleation. Next one is our, if there is a involvement of the maxillary cuspid, that is canine, we will go for marsupialization. Basically, marsupialization is a surgical procedure in which the cyst wall is opened and sutured to the oral mucosa to create a pouch through which the cyst will be drained. Now coming to the complications, that what complications can be caused if we will not look after the dentigerous cyst. First one is our squamous cell carcinoma. It is also known as the epidermoid carcinoma. Next one is our ameloblastoma. It is an anatomically benign odontogenic tumor. Next one, mucoepidermoid carcinoma. So that's all about the dentigerous cyst. Thank you for watching and subscribe for more.